I'm going to bring you the global situation on coronavirus now. Head of our health desk, Fred Smith, is joining me via Zoom. Hello, Fred.
Hello, Gifty. How are you doing?
I'm not bad at all. It's good to have you via Zoom. This is like the first time and I'm feeling very excited. So let's take a look at the global front. I mean, US President Donald Trump has been lambasted by the medical community, especially for suggesting that research into whether or not coronavirus might be treated by injecting heat could be transferred to the body. So essentially saying, well, how about disinfecting, injecting some disinfectant into the body? Tell us more about the global outlook.
Well, as you know, Gifty, the global situation has topped 2.7 million people have been infected so far. 192,000 persons have so far died, and we've had a lot of recoveries. Over 4.6 million people have recovered, but of course the United States is leading, so you'd understand why the US president will come under such criticism if he makes such a comment. His country is indeed struggling with 870,000 cases in the United States alone, as many as 50,000 persons in the country have died. I'll take you around the world to see what's going on with coronavirus. In Singapore, for instance, they are saying that they knew that the foreign workers would be a stress point, and that's coming from a diplomat there, because persons who are not originally from Singapore and have found themselves there, that probably would be the situation in all other countries if you happen to be in transit and you're caught up in this situation. We know some persons who are already in Ghana. They came for a conference and should have returned to their countries. They don't have any means of generating incomes in Ghana, and they are stuck here. They don't have relatives who can support them locally. And that's the challenge with many persons, and especially in Singapore, that situation has come up, and that country is trying to find ways of dealing with it. In the same country, the health ministry has confirmed 897 new cases, so their cases are going up. It's the reason why the diplomatic community is interested in those who are caught up in this whole thing. And it's so far unclear if the United States, Europe can reopen. Their new coronavirus cases are high because Fitch is saying that once they do, cases can go up again. So there's that risk again for the United States and Europe. But already, Spain has already started reopening some of its, easing some of its lockdown measures. And Germany is also recording more cases. It gives you the idea of what's happening around the world. Cases are easing a bit, but there's a risk if these countries decide to open up.
Fred, I tell you what, it's been very interesting how gradually the focus has shifted from the epicenter or the origin of this virus, which is China, Wuhan to be specific, and now to Europe. Europe is actually easing the restrictions. We've been speaking to Thomas Sparrow, who's been telling us how they are gradually trying to get back to normal life. But do we know what is happening in China, where this outbreak first started?
Well, China in the last 2 or so weeks have also started easing their restrictions. In fact, they were the first to start easing restrictions. And Wuhan specifically, where the whole epidemic or the pandemic broke out, they have resumed full service. So a lot of companies working then, some of the popular air conditioners, some vehicles are all produced in Wuhan. They've all resumed work fully. And so they have resumed, and other parts of China are also fully at work. So the Chinese economy is back full time, and it's only a matter of time because the cases have also significantly dropped.
Well, we see how that goes. But Fred, what can you say about the African outlook? We just played a clip of President Akufo-Addo interacting with his colleagues, heads of state across the continent. What do we know about the African outlook? How is it looking for us as a continent?
Well, let me start you from West Africa, the ECOWAS region. We so far have 6,525 cases in all, and we've had 1,968 persons recovering. The deaths in West Africa stands at 170, and the active cases 4,387. That's the subtraction of our recoveries from what cases we have. And so that's our situation. In terms of which countries are doing what in terms of the cases, you have Benin with 54, Burkina Faso 616, Cape Verde with 82, Cote d'Ivoire with 1,004, the Gambia with 10, Ghana 1,154. Well, Ghana's case has not been updated yet because we've gone up from the 1,154. Then Guinea 862, Guinea-Bissau 50, Liberia 101, Mali 309, Niger 671, Nigeria 981, Senegal 479, Sierra Leone has 64, and then Togo with 88. That's the situation with West Africa. But of course, for the Africa region, you know, some of these countries, South Africa, for instance, is one of the countries recording most cases in Africa. I'll look for their figures and give you in a jiffy. But we have South Africa, we have Egypt. South Africa with 3,953 cases so far. Very soon they will hit 4,000 cases, and altogether they have 75 deaths in South Africa. And then for Egypt, they have 3,891. Morocco follows with 3,692. Those are the countries leading in Africa in terms of cases recorded for coronavirus. Gifty.
What can we do but to keep ourselves protected and make sure that we keep others protected as well as we look at these rising, ever-rising figures? Fred, thank you so much for those updates. And I was just wondering what the situation now report is from your home as well.
It's very calm at home.
It's very calm. I can see that.
Yeah, it's very calm at home. Everybody is safe because mommy and the children don't go out at all. I'm the only one who sometimes go to work and return.
Who is on the front line?
I also take extra precaution not to bring any virus back home. So everything is fine.
Hopefully the precautions are working. Fred, thank you. Fred Smith is head of our health desk here, working from home, obviously, coming to us via Zoom. Fred is also the producer for the show, I must say. So he's working from home, and we have other producers who are working from here as well. But that's on a more serious note, the global outlook. It's not looking so good, especially for the United States, for Europe, but they're still trying to ease up gradually. It's not very good for the African countries that Fred indicated, also South Africa, Morocco, etc. Well, what you can do in your part to make sure that Ghana doesn't even get there is to stay at home if you have nothing doing, no business doing. If the things you need to do outside can be done at home, stay at home and get it done. What you can also do is wear your face masks, especially when you're among people. What you can do is keep washing your hand and keep using sanitizers. You can also be spraying sanitizers or rubbing alcohol on your shoes, because we understand that you can carry the virus right into your homes with your shoes. It doesn't get any easier, but you have a personal responsibility. All right, let's move away from COVID-19 with some of your text message before we do some politics right now. Okay, well, it's still the politics is still COVID anyway. It's like we can't do anything without COVID right now. So some of the messages coming in: Trump's up to the oh yes, I think you're trying to say thumbs up to the local manufacturers doing PPEs, but in order to be sure of its quality and trustworthy material, I'll encourage the COVID-19 team to consider testing the workers so that our able and hard-working frontline workers are not infected with the virus. From San Obed at Zabzugu in the northern region, Mr. Obed, he's been sending messages quite consistently. This one has a very long message. I'll see if I can read some of it. Please, I don't want to mention my name. If JoyNews can take it upon themselves to come to Oyibi Valley View University Hospital and the CHAG to investigate, most of them are listed as frontline workers, nurses, but are not. They are rather those at the administration managing the hospital who don't come in contact with patients, leaving most of the nurses and the midwives behind. You go on to say that the annoying part is that the HR's name was listed, leaving most of the frontliners. We'll have to investigate this. We cannot independently confirm this. Without investigation, we can't go on with it. Let me see if I can get one final one, and then we'll move on. Good afternoon, Gifty, he says. In fact, since Wale Wale recorded its first positive case, they took samples of about 42 individuals, and out of the number, we are told that only one person is positive. So the question is, how come only one positive case and authorities are not saying anything again? From Wafik in Wale Wale. Wafik, are you wondering why only one positive case came out of 42? It's possible, but yeah, certainly it's good to ask the question.